Hello and welcome to Community Difference Makers, brought to you by Bankers Trust and United Way of Central Iowa. I'm your host, Emily Abbas, and this season we're teaming up with United Way to take a deeper look at issues in our community. These critical community issues such as food insecurity, access to childcare, youth violence, and more. Today's our second conversation on affordable housing and homelessness. And today we'll be digging deeper into really the root causes, poverty, affordability, and what it really means to be just one paycheck away from a crisis. We'll again talk about ALICE, as term that stands for Asset Limited Income Constrained, yet employed. And the vast majority of these households that we're talking about are people who are working. They're working every day, sometimes in multiple jobs, but they still can't afford the basic costs of living in our community. So it's a topic that we'll continue to keep top of mind. To help us connect those dots between poverty, housing, and health, we're joined today by two wonderful people who see this work up close every day. First is Shelby Ridley, Director of Programs at Primary Healthcare Iowa. Welcome.
Thank you.
Primary Healthcare Iowa provides medical and supportive services for individuals and families experiencing homelessness. And returning guest, Erin Davison-Rippey, Senior Community Impact Officer at United Way of Central Iowa. Thank you both for joining today. I look forward to our conversation.
Thanks for having us.
Thank you.
So as we jump in, Erin, let's start with you. Why don't we talk about housing affordability? Here in Central Iowa, what does that mean today? How does United Way's data, especially from the ALICE report, paint that picture?
Yeah. So when we look at the ALICE report, it's pretty staggering to think about the scope of this. So here in Central Iowa, 1 in 3 families simply can't afford the basic needs. And when you think about, rent and housing, that's a really significant portion of a household's budget. Right now, when we look at renters in Central Iowa, nearly half of them are what we would consider housing burdened. So that means that they are spending more than a third of their income on their housing. So that's a significant expense, and that's a lot of people who are housing burdened. It's even more challenging when we look at folks that are extremely low income. So for those folks, for every 100 affordable homes that are needed, there are actually only 23 homes available. So we have a real challenge in identifying affordable homes for folks with really low incomes.
Wow, so less than 1/4 of those folks that need homes right now there's just no quantity available.
Yeah, for those,
Okay.
folks that are really, really low income. And so, what that means is that when they have, such limited opportunities for housing, folks are having to make just absolutely impossible choices. If they're paying, more than a third of their income on housing, they're having to make cuts in their budget somewhere else. And so that may be scrimping on food or making tough decisions around, childcare, or, they're looking at living arrangements that are not ideal, whether it's housing in spaces that are not as safe or not big enough for the family, just really tough decisions. And that creates an incredible amount of financial stress on a family that has a real impact on that family's success.
Mm-hmm. And that's a really sobering picture, especially that we know that most of these families are working. And it reinforces what we learned when we talked about food insecurity. These issues are not in silos.
Everything is
dealing with
connected.
housing, you're dealing with food. If you're dealing with food, you're dealing with childcare. And so that's why we're just so excited to partner with you and figure out how do we make a difference and how do we amplify these issues with our community members. Shelby, let's turn to you. You work directly with families and individuals who are experiencing homelessness and housing insecurity. How does this affordability gap show up in the lives of the people that you serve every single day?
So for us, what we see is that people are making those really hard decisions. Do I pay rent? Do I buy food? Do I pay for transportation to go to work? And they're making these choices and knowing that they can't ever pay for everything all at one time. And so sometimes their rent payment doesn't come on time. And we have seen more evictions in the last probably 2 years than we've seen previously, making it harder to get rehoused. We know that families are they're constantly trying to figure out how to juggle all of the balls, and a lot of them are dropped. And so we try to show up to help them hold all of those things and to figure out what the next resource is. But the community itself is often resource limited. And so we're also trying to just kind of figure out how do we How do we prioritize what some of those needs are, and help them make the next right decision for their household? And that's also really hard because every household is different.
Yeah. And no matter what decision you make, there's downstream consequences.
There are.
Erin, let's go a little deeper into Alice. What makes those households so vulnerable when it comes to specifically this housing instability issue that we're tackling today?
Yeah, absolutely. So, like you've mentioned, Alice families primarily are working and many times, oftentimes, more than one job, just trying to make ends meet. And when we think about the definition of Alice families, these are generally folks that are earning above what we would consider the federal poverty level, which is sort of has to do with qualifying for supports and services. And folks that are above the poverty level oftentimes are not qualifying for any support. So I think, this is something that is kind of a misnomer, that folks think that, well, if someone is low income, they're qualifying for public services or public supports. And oftentimes that is just not the case. So many Alice families cannot make ends meet, but don't qualify for, let's say, childcare assistance or food assistance. And so they're out there on their own without supports from the community, from the government. And it means that so many times these families are just one kind of occurrence in their life from a disaster, whether that's a medical bill or a flat tire. So many folks just don't have, the resources to be able to cover an unexpected expense. And so, that one unexpected expense could make the difference between staying housed or not. And when you think again of those downstream effects, if a family or an individual is unhoused, retaining their employment is really challenging, providing for, food and healthcare, all of those things are impacted by someone's housing status.
And we often think of poverty as something that affects someone else, right? Not us. But the Alice data really shows how close many of our neighbors and friends and are to, really truly falling behind. Erin, let's stay with you. What are the long-term implications of our community when so many working families just can't make ends meet?
Yeah, well, and Alice folks are the engine of our economy. Workers that are under that Alice threshold so often are performing the jobs that make sure that our economy is running and running smoothly, whether that is childcare workers or food service workers, folks working in healthcare as personal care aides, delivery drivers, so many folks in our community that really ensure that our economy can run. And what the data shows is that if households have sufficient income to make ends meet, they are able to go through life. Their physical health is improved, their mental health is improved. You think about if kids in that family are in a safe and quality childcare setting, that makes a difference for those kiddos throughout their entire life. So it really ensures, both that our economy is operational, but just as a society that folks are able to meet their basic needs, be healthy and make ends meet. And that makes a huge difference, not just for those individuals, but really for all of us in our community.
Yeah, that makes a lot of sense. And United Way is really known for bringing together partners from across all sectors. So how can local employers and business leaders respond when they see that maybe many of the employees that they work with are falling within this Alice population?
Yeah. So, one of the things that as United Way, we found that this data and information about the Alice population is really surprising for a lot of folks. Like you were saying, I think when we talk about poverty, it can often feel like, well, that is someone else. That's not anyone that I know. That's not, folks in my community. But when we talk about the Alice population, when we run through what the budgets look like for Alice families, folks really develop a much deeper understanding of what it looks like to try to make ends meet here in our community. And that's the really exciting part about the Alice data, is that it is specific to our community. And what does it take to afford housing in central Iowa? What does it take to afford food in central Iowa? And so that education piece that United Way of Central Iowa and others are doing is just critically important for, employers and other stakeholders to understand that this is not some, other folks that we don't know. These are our friends, our neighbors, our employees, folks that we're going to church with. These are people right here in our community, and we all know somebody, or probably many somebodies, who are in the Alice population. 1 in 3 Central Iowa households is Alice. And so, I think that really prompts conversations around how do we support everyone in our community, including folks that are Alice. So leading to conversations about, wages and what are the supports that are available for families that are struggling to make ends meet. I think those conversations really require that base level of understanding of the reality that Alice families are facing in our community in order to understand that we all have to be part of the solution. It's not somebody else's problem. It is for all of us to work together to solve.
Well, and a good reminder, you just never know what someone's going through and what they might be masking or not sharing. And let's all give each other a little grace and be supportive and help work together. At Primary Healthcare, Shelby, you and your team are on the front lines. So you provide that centralized intake for support services. When someone loses housing, what happens next in terms of health and access to support?
I think their access to support really decreases or if you find out kind of where that support lies. So they first often turn toward family and friends. What can their support systems do to help them? But a lot of times their family is also struggling with the same things. And so, they've tried doubling up, they've tried, borrowing money to make ends meet, and that hasn't worked. And so then they end up at centralized intake a lot of that time. And we are trying to figure out what's going on. We're really trying to put all of the pieces of the puzzle together at that point in time and figure out what support can this community provide. Everybody needs a different level of support to get back to that stability piece. And so do we have access to those supports? Can we make those referrals? We try to be experts in how do systems work so that we know how to easily access systems for folks who have kiddos. They oftentimes turn to the schools as their supports. And so we work closely with the metro schools to make sure that we're connected in and that people are not falling through the cracks, that they have access to shelter and resources that they need. And for their health, it often declines because they don't have access to medical appointments. For a lot of our folks who are experiencing homelessness, they've missed a lot of medical appointments just trying to survive. And so they can't necessarily go back to their primary care provider. It's hard for them to make those appointments. And so we want to make sure that at PHC we have access to medical services as well as to our homeless support services, trying to stop the decline of health. But for a lot of our folks, they just don't have access to medications and those ongoing appointments like they should.
Yeah, and before we continue on that housing and healthcare connection, I want to take a step back and just make sure our listeners are clear on when we talk about centralized intake. I use the term. Explain what that means and maybe how that's a little different than how our community was set up years ago.
So the community years ago really put the burden of knowing resources on clients. So if I was a mom with a few kids and looking for shelter, I had to call all of those shelters every day consistently to see if they had an opening. I had to take time off of work to be able to do that. I had to know those resources and be able to advocate for myself. Centralized intake provides a front door approach to that. So you come into centralized intake, everything that we do is on a walk-in basis. So on a schedule that works for you, you can come in, meet with an intake worker. We hold the family shelter waiting list. We hold housing waiting lists. So it takes away some of the subjectivity of who's using the resources. And we can really look at, okay, we have a family shelter opening. This person has the most barriers and they have the family size available for that. So we're going to slot them into that. It is challenging because we are constantly working with more clients and fewer resources. So we do have to make prioritization decisions, but that isn't for the client. The burden of the information and the resources isn't on the client anymore. It's on us to be system experts and to help them navigate that system.
So we've come a long ways.
So far.
but we have a long ways to go.
We do.
But it shows that progress can be made, and we can make things a little bit more simple. When it comes back to that housing and healthcare connection, can you talk about the challenges of helping someone regain stability after they've lost housing? And then what does success look like when the care system works in the way that it's really supposed to and set up to?
Some of the challenges in regaining that stability, we obviously want to stop as many people from entering the homeless crisis response system as possible. When you're in the system, it's really hard to exit the system. So if we can stop you from ever entering, that's really the ideal outcome. But for a lot of our folks, we have housing programs that we can make referrals to, and they get access to case management support. So have somebody who's walking next to them along the way to say, okay, how do we help you find a job, or how do we help you find a job that pays more than what you have been making? How do we do a budget? What are those next steps? But for a lot of folks, because we've talked about not having enough resources in the community, they don't have a case manager to walk alongside them. And so the burden of knowing the resources and figuring out how to make those next steps is even harder. And oftentimes they're waiting for a housing solution that is a long ways away, unfortunately. So we do the best we can in being able to know the resources. For a lot of our folks who are living unsheltered, they're connecting with our street outreach workers who are in the community and helping them kind of walk along. How do we get you your vital documents? If you don't have your vital documents, it's really hard to do almost anything, including finding employment. And so we just meet people where they're at, trying to figure out what the next step is. And when the care system works the way that it's supposed to, it looks like equitable access for everybody, and hopefully enough resources in the community to meet the needs of the community. Right now, that's been a struggle. And so we do the very best that we can to provide support to as many folks as we can, but we know that we don't have the level of resources. And I think for health systems, what that looks like is making sure that we have access for everyone, even the folks who have maybe struggled to attend appointments or struggled with that consistency related to their homelessness. It's hard to show up for appointments when you don't know where you're going to eat or sleep later. Yeah. And I think that's something that primary health care is also looked at as a federally qualified health center, is making sure that we have walk-in access to medical appointments so people can use the right level of care and maybe not using the emergency rooms as that healthcare system, which is oftentimes what happens.
Yeah. Erin, let's take it to a systems level. What are the key levers that can move the needle on housing affordability here in Central Iowa?
Yeah. So like we've talked about, these issues are all really interconnected, and this is a complex system. But I think there's a few areas as we think about, we talked about at the beginning, just having enough affordable housing for individuals in need. And that really happens on a spectrum or a continuum, right? So, ensuring that there's affordable housing for folks that are very low income, but also ensuring that there's affordable housing for folks at all different kinds of income. Because if you have a gap in that system anywhere, then everything else backs up behind it. So, even if you're able to, stabilize a family, get them into affordable housing, then the hope is that, we're working with them as a community to build their income, and, maybe they can take that next step up and move to, a different place. Well, there has to be housing available for them. And so you think about that continuum. Any one part of the continuum not working impacts the rest of it. So it is a comprehensive piece there. I think also another piece is making sure that folks have the supportive services, right? So this isn't just about the home, the apartment. It's about all of the care that wraps around them. Shelby, you've done a great job of talking about all of the different ways that you all are supporting folks in our community. Folks that are at risk of homelessness or unhoused, there's a lot going on in their lives. And so, figuring out how are we providing them with supportive services in all of those areas of life so that they are able to be successful. Like we've talked about, it's looking at wages, ensuring that folks have wages that allow them to meet their basic needs. At the end of the day, that is crucial to ensuring the success of those individuals and families. And then, you think about things like access to childcare. If folks don't have access to childcare, then they're not able to work. And so, those wages are reliant upon affordable and safe and quality childcare. Thinking about transportation. How are they going to get to their job? How are they going to get kiddos to childcare? How are, they getting folks to school? Those systems are all impacting families' ability to be housed and maintain that housing. And so these are complex systems. And it's all pieces that we need to be working and addressing as a community to ensure that folks can be housed.
So it sounds like it really requires a lot of cross-sector collaborations, and Shelby, you've been a part of those. How do these partnerships, is there anything else you want to add on how these partnerships between people like healthcare providers, housing organizations, social services create better outcomes for clients? Let's focus on the outcomes.
I think it's understanding how each system works so that clients can navigate those systems. If I'm frustrated by a system, then a person who is experiencing homelessness is also going to be frustrated and sometimes give up in navigating those systems. And so when we all work together and we all understand how to access what's necessary, what's a great referral versus maybe this isn't the right referral for that person, I think we get a lot more, we get a lot better outcomes in how people can use the systems and making sure that they're entering kind of the right door, and understanding other services. So I can't just understand homelessness and housing. I have to understand health and disability, how to get a social security card. I like to say that my team has weird and wide knowledge because we just have to know a lot about that. And so we want to share that knowledge. We want to work with other folks so that we can make sure that as a support community that we can do that. And I know the right person to call if I don't know the answer.
Mm-hmm. And sometimes it's just that it's hard to figure some of these things out. It's hard for any of us to figure some of these things out. But if you're hungry and you don't know where you're going to sleep and you don't know where your next paycheck's coming from, or you don't have a ride to get to the place you need to go to do these things and you don't know how to get there, I mean, it's hard to figure it out. So we're fortunate to have these resources. But I think it's also important to talk about how do we not just address emergencies, but create lasting stability for these families. Erin, any thoughts there?
Yeah, Shelby really outlined so well, how challenging it can be to navigate the system. And so that's a piece of it. But also at the end of the day, like you were saying, we just simply don't have enough resources in our community. And that includes, addressing those emergencies. And especially when we think of prevention. So, if we think about Alice households that are, one emergency expense away from a crisis, how do we take preventative approaches to ensure that, they have more stability? You know, uh, Shelby, you mentioned this, that once someone is experiencing homelessness, that is a much bigger challenge. So how are we thinking about how do we keep folks currently housed? So whether that is, looking at the eviction laws, there's some work there that we can do to ensure that, if folks are going through, eviction proceedings, if that doesn't result in an eviction, that shouldn't stay on their record. But we have to address the policy there, ensuring that we have supports and programs and systems to keep people housed. And so, if that is short-term rental assistance or utility assistance, figuring out how to keep those folks in their homes so that they are not having to enter that sort of emergency response system in homelessness. Thinking about, like we've talked about, transportation, childcare. There's a lot that we can do on the prevention side of things, but that really requires both, public investment in those supports and services, as well as philanthropic investment. But at the end of the day, we do not have enough resources in our community to meet the needs of folks that are experiencing homelessness.
So there's clearly there are challenges, and both of you are working in spaces where the challenges are great, but so is the impact. What gives you hope that we can make progress on housing and poverty here in Central Iowa? Shelby, let's start with you.
I think on a very basic level for me, the things that give me hope on the day to day are the work that my team does, and I get to see that work and the team that works with me and the folks at PHC and the colleagues that I have that are also working the homeless crisis response system, and they're fighting to make sure that people have access to resources all of the time. And then I think as a community, the support that we have from funders and from other organizations to have hard conversations, that we're not just letting things slide by, and that I know that I can come to United Way and say, this is an issue that we're seeing. Are you seeing this somewhere else? Can you make those connections for us? And it's a frank conversation. It's not just surface level. And I think that's a really unique thing.
Yeah. Thanks for being a part of this conversation.
Thank you.
Erin, anything to add?
Yeah, I agree that seeing our community come together to address these issues, that gives me so much hope. And again, we have done a lot. Like centralized intake is a great example of that. There are so many more things that, we're currently working on. The community has come together to create a strategic plan to address homelessness here in central Iowa, and seeing the opportunities that we have to work even more collaboratively so that, it's not any one organization or any one caseworker's, challenge to solve these issues. Coming together as community is how we address and solve these big systemic problems. But we have the ability to make a real difference. We've done it in the past. We're doing it right now. And there's so much opportunity in the future. And that gives me incredible hope.
I feel the hope in your voice.
Yes.
I love it. Anything else either of you want to share or put a punctuation mark on before we close out today?
I don't think so.
Yeah, I don't think so.
Well, I appreciate some of the themes that came through about really meeting people where they are, keeping people in their homes, and meeting the needs of the community. So thank you both for doing that. Shelby with Primary Health Care and Erin with United Way. When we talk about housing and poverty, we're not just talking about numbers on a page. Clearly today, we're not talking about numbers. We're talking about families. We're talking about our neighbors. We're talking the future of this community that we all love. To learn more about Alice and how you can help ensure that every Central Iowan has a safe, stable place to live, visit unitedwaydm.org/housing. I'm Emily Abbas with Bankers Trust. Thanks for joining our Community Difference Makers podcast. When we come together around a shared purpose, we don't just talk about change, we make it happen. Join us next time for part 3 in our 4-part series on housing and homelessness. We'll be hearing real stories from those with lived experiences on housing instability and people who are just on the ground working with them and trying to help connect them to these services that we've talked so much about today.